Hey listeners, after the pod, don't forget to claim your free 2-week trial on the Better Yoga Online Studio. You'll get unlimited yoga and breathwork classes guided by expert instructors. We're a small women-owned business, and you signing up for the free trial really makes a difference. Now here's the show.
Hello and welcome everyone to the Better Yoga Podcast. I am Tiger Bai, and today we are joined by an extra special guest, my friend, Dr. Meghan Teed. Meghan is a doctor of physical therapy, a scoliosis specialist trained in the Schroff method, and a Pilates trainer. I'm very excited to get to speak with her today all about scoliosis. So thank you so much for being here today, Meghan.
Thanks for having me, Tiger. Happy to be here.
So we always start our podcasts with the same question, interpret as you may. What does your practice look like nowadays?
It has evolved quite a bit over the years, but currently I would say my practice, when I think of practice, I think of movement practice. I have a blend of functional movement exercises that I do, running and Pilates right now.
Excellent. I always see on your Instagram lots of fun things you're doing in the morning between runs and red light therapy and walking your dog. You strike me as somebody who really practices what you preach.
Yes, that's really important to me. I feel like it holds me accountable because I tell my patients and my clients specific things that they need to be doing on a regular basis. So I also want to show them that I am, doing those things as well. And it truly works. It truly helps, having those consistent things woven into your routine. That is why I encourage people to do it. And, the results definitely speak for themselves.
Totally. So before we get into more details, for those less familiar with scoliosis, can you sort of define the condition and maybe some key words like prominence, S curve, C curve, things like that?
Definitely, yeah. So scoliosis is a three-dimensional curve of your spine. A lot of people, they see a scoliosis when they think of scoliosis, they think of like just the side bend aspect of the scoliosis. But in reality, there's a really strong rotational aspect to it as well. So we want to make sure that we're not just thinking of the spine like on a sheet of paper or on an x-ray. The curve has to be at least a 10-degree Cobb angle in order to be considered a scoliosis. So if you have an 8-degree curve, you don't have scoliosis technically. And also you have to have at least 5 degrees of rotation on a scoliometer, which is this measurement tool that, when you bend forward, you may have been screened for scoliosis in a gym class and had to do this, where you bend forward and you reach for your toes, and the nurse or some volunteer runs their hand along your back to see if you have rotation or a rib prominence that's sticking upward towards the ceiling. So the rib prominence area, that is the area that a lot of people, can visibly see when they have a scoliosis on themselves. Like that's something that stands out to them, maybe bothers them aesthetically. Even physically, it can be uncomfortable sitting against a chair. You have one side that is touching the chair and the other side of your spine doesn't touch the chair. So it could just be uncomfortable in that way. But that is the convex side of your curve. And the opposite side, the hollow side, the empty side, that is the concave side of the curve of the scoliosis. That's a pretty like basic definition of a scoliosis.
Yeah, as I'm sure we'll get into, more complicated than just a definition, but I think helpful for people who again, maybe just visualizing a scoliosis as that two-dimensional curve, looking at it front on, but of course we are three-dimensional, multi-dynamic bodies. So I know it gets more complex than that. I'm sure there are many people out there who are experiencing scoliosis, but perhaps are unaware of it. How might somebody screen for scoliosis? Are there at-home assessments, or is it important to have a medical professional be taking a look at your spine?
Yeah, there's definitely some ways that you can pick up on it on your own, and then you would want to have a medical professional confirm or deny that you actually have it. Some ways would be looking at the way that your clothes are fitting on your body. So if you are female and you have spaghetti straps or bra straps that you are wearing, and you have one side that always slips off of one shoulder and it stays on the other shoulder pretty well, that could be an indication that maybe you have a curve happening in your spine. Taking a look at just your positioning in a mirror, looking to see if you have one shoulder that is sitting quite a bit lower than the other, that would be a sign as well. And then looking at your shoulder blades. So, this is called like a winging scapula, when your shoulder blade kind of pulls away from your thorax or the trunk of your body. You may have one side that is winging quite a bit or tips upward, and the other one is flat. That's another sign, or a way to screen for it. And then if you move down to the pelvis, and you think about your pants, the way that they're sitting on your hips, you may have one side that hikes up higher than the other. One thing that a lot of people say that have scoliosis, they're like, "Oh, I have like a baby carrying hip," where one hip kind of protrudes out to the side, and it creates like a little bit of a shelf to hold their baby on. Um, that's definitely an indication that you have an asymmetry going on in your body. And then the length of your pant legs. If you have one hem of your pants that kind of drags on the floor, and the other one is more like a flood pant, that could be an indication of that maybe you have a scoliosis. And then finally, the most obvious one is when you bend forward and you see that rib protrusion or that rib prominence. That's a very strong indication that you probably have a scoliosis happening with your spine. So, um, in order to actually confirm that, you would need to have an X-ray done by your doctor. You could just go to your general practitioner for that, and they would take that X-ray, and then they would measure your Cobb angle if you have one, and then if you have a Cobb angle greater than 10 degrees, then that confirms that you have a scoliosis.
And can you talk a little bit about the causes of a scoliosis? Is it always something people are born with? Is it something that's developed from behaviors or other conditions? How does one come to have a scoliosis?
That's the $1,000,000 question. Lots of research being done on, what exactly is the root cause of scoliosis. There are different forms of scoliosis. There's congenital, something that you're born with. There's neurological. So if you have a condition, like a nervous system condition, that could create a scoliosis as well. But the highest amount of people who have a scoliosis, they fall into the idiopathic category of scoliosis, which means it's unknown why that person has scoliosis. Now, research that's being done currently, there's a lot of different factors that are coming to light, but there isn't one that's like stronger than the other currently. One of the factors would be that it's genetic. So there's a really high correlation, especially if you're female, that like if you have scoliosis, likely maybe your mom had it, but a higher likelihood that your grandmother had it. Like it kind of like skips every other generation in some families. But then I was just talking to a colleague of mine the other day, and she was like, yeah, I'm working with this lady and she has scoliosis. She's in her 70s and all 4 of her daughters have scoliosis. So it just, varies family to family, but there is definitely a very strong genetic component to it, but it's not always like a 100% correlation there. And then there's also a really strong hormonal component to it. There's a 1-to-3 ratio, so male to female ratio. So 1 male to 3 females have scoliosis. And females, there's 3 different times that your curve can show up or that it can progress. And the first time is during adolescence. So when you're going through puberty, that's, the one that gets picked up on, that is screened for regularly. The second 2, they aren't actually screened for, and I think it would be pretty critical to begin implementing screenings for these 2 populations. So the first one would be pre and postnatal. So after you have a child, maybe you had a really, really small curve that nobody noticed when you were in adolescence. And then after you have gone through pregnancy, postpartum, had that relaxin happen, all those hormone changes happen within the body, things shift around. Maybe you weren't exercising as much as you were leading up to your pregnancy, and that curve can progress at that time. And then the final time is during menopause. So, those 2 times would be really great if your doctors would actually do like a little bit of a screen. It's so quick just to have somebody bend forward and reach for the floor to see if there's rotation happening, and then you can lead them down the path of investigating that further, because there's lots of things that they could do to prevent that from progressing. And then there's also an emotional component to the scoliosis, which is much less investigated and researched. This is more of an observation that I've seen with my patients and with my clients.
Cats and dogs everywhere.
It's like every time I try to record, she just wants to hop up and rub up on the mic and the computer.
Better Yoga is really animal friendly. Kari has like 8,000 animals. So we're into it. It's okay.
But, if you think emotionally about what happens, when you're feeling sad or protective of yourself, how you kind of round the shoulders forward, you retract from the person in front of you or your surroundings. You're altering your posture and your positioning based off of those emotions, and that is an outward, scoliosis is an outward reflection. A lot of times they think of emotional things that people are holding on to or have experienced in their life. Is that something that I ask most of the people that I work with is if they grew up with a controlling parent in their childhood. And I would say 95% of those people say yes.
Wow.
Yeah. So there's a very strong connection there. I don't exactly understand that, but it's just something interesting to make note of. Um, so those are the idiopathic groupings of, you know, what research is kind of leaning down different avenues to try and super confirm one of those, but right now it's more, so we're not really sure.
Hmm. So it's so interesting. You have a personal connection to your work. Would you tell us about how scoliosis became your area of specialization in physical therapy?
Yeah, so I was diagnosed with scoliosis when I was 11. I was in gym class, kind of what I was describing, that little screening process, and my mom and I went to my doctor. They confirmed that I had it, but it wasn't really bad enough to do anything about it. So we just watched to see if it would get worse, which is an awesome way of treating the condition or addressing it. There weren't really many other options at that time anyway. The only other options that were available to people were bracing or surgery, and I wasn't bad enough to really do either of those things. So doctor was like, just keep doing what you're doing. And I was in ballet at that time, and I really do believe that that helped my curve not progress further than it was at that time, because I had a lot of awareness of my body positioning. You know, they really encourage you to keep, all of your body blocks stacked on top of each other. They really promote a symmetrical positioning of your body. So I think that that actually helped me. Um, I would be curious if I wasn't involved in ballet, if I was involved in a different sport, if things would have gone a different trajectory.
Yeah, like
But
tennis, just one
yeah,
direction.
no.
Yeah.
Yeah, exactly. Um, so so then I went to, you know, I went about my life. My curve never progressed within that time frame that they were actually monitoring me. So I stayed less than a 25-degree curve at that time. And then, I went about my life, decided to go to physical therapy school, thought that, like, oh, maybe I'll learn, some interesting things about my scoliosis and how to address it a little bit better. But in physical therapy school, I had an hour-long lecture on scoliosis, and they were basically teaching us just to bend the person the opposite way of their curve. Like, that was
Oh
the
my
extent
gosh.
of what we learned. So, I just kind of blew it off, and I didn't really think about it much beyond that. And then, I practiced PT for 3.5, 4 years. I was, abroad, or not abroad. I was on the West Coast, just doing general PT. And then I moved to Bluffton, and I got involved in the Pilates community here and got to know this owner of a studio here, Jen Wolf. If you live in Bluffton, she's an excellent Pilates instructor here. Um, and she was like, "Hey, I have an instructor. I know you have scoliosis. She is doing some specialized training in scoliosis and would love for you to be her case study." And I was like, "Heck yeah, like, sweet." I didn't know that that was even like a thing to specialize in scoliosis or Pilates for scoliosis. So through that experience, I learned a ton about myself and my curve, and got very curious about expanding that knowledge. And I started applying what I was learning on my own body, about my own body, to my patients. And then I went and did a Pilates for scoliosis training. And then I went further down that rabbit hole, and I got specialized in the Schroth method, which is the gold standard for physical therapy, or for treating scoliosis in physical therapy world. So long story to get to where I am now, but um, since I've done all that specialized training, I've honed other things into what I do with my own body and with my patients, because the specialized training, while it's really wonderful for very structured scenarios, like, you know, while you're working with your practitioner, it doesn't exactly translate to life, everyday life, because they only teach you how to maintain this neutral spine all day, every day. And that's not how life is. Life is multidimensional. It's rotational. It's, you go into side bending and all sorts of different directions with your movement. And if you're not taught how to do that in a curve conscious way, you can end up creating more issues down the line.
Yeah, I think your personal connection and life experience with scoliosis really bolsters your work with clients. You really get it. You know what they're going through in many ways, which is, I'm sure, for them, a really helpful perspective. So you mentioned just a little bit about in your physical therapy education, your module on scoliosis, them sort of instructing, bending the opposite way of the curve. And I know a lot of people with scoliosis are told to just stretch or just do yoga. Why might this advice be misleading, especially without working with a trained professional who understands scoliosis?
Well, I would take you back to the definition of scoliosis and the fact that it's three-dimensional in nature. So just purely side bending somebody the opposite way completely disregards the fact that there's a rotational component to the scoliosis. And then the other thing to take into consideration is most people that have a curve or have a scoliosis, they don't have just one curve. They have a primary curve that's super obvious and visible, but they also have these compensating curves above and below that main curve that completely get neglected by that way of thinking. If you're just saying, okay, we're going to side bend the other way, well, what about those other two curves? Then you're actually feeding those two curves when you're just side bending the opposite way. So it's really important to work with somebody who understands those nuances in order to get a good handle and a good grasp on what exactly needs to be happening for you specifically with your curve. Um, there are some people who have just one curve, and that's considered a C curve. If we're using that terminology. And yes, technically you could just, side bend that person the other way, but we also want to think about the rotation for that curve type.
Yeah. I think that in many scenarios, people are told to just stretch, to just open up. And without that deeper knowledge, which feeds into understanding the importance of strengthening and balancing,
Mhm.
yeah, you can actually be making things a little bit worse.
Yeah.
Yeah.
Especially so with just telling people to stretch with scoliosis, one thing that's, seems like it'd be so good and super tempting to do would be just hanging from a pull-up bar and letting yourself like just rest and dead hang in that position. And it it does feel super nice in the moment. But when you come out of that really extreme elongation and that traction, that's where you get into trouble because your brain, um, with scoliosis and with other spinal conditions as well, it sees that extreme lengthening and that extreme stretch positioning as a threat because you've lived your whole life in this curve, this side bent position, and then you're taking that person out of it into like the most extreme position that they could be in. So the brain is like, I don't think so. And then you end up reflexively tightening up and retracting maybe even further than you were retracted before you did that elongation.
Save 15% on Ayurvedic products like oils, herbs, cleansing supplies, and more from Banyan Botanicals. Use the code 15KARI. That's 15 KARI. The link is in our show notes. You deserve to know exactly what's in your greens and protein powders. That's why Vibrant Health fully discloses every ingredient by dose and never uses proprietary blends. Save 20% on your next order with the code BETTER_YOGA. That's better_yoga for 20% off Vibrant Health supplements and superfoods.
Yeah, that's super popular. You see on social media all the time people doing these dead hangs, and yeah, that makes a lot of sense. And also, I feel like it's kind of a misnomer in general for that exercise because there sort of needs to be a core strength component to that exercise to have it even be safe for any spine, let alone one that is going to have a curve in it.
Mhm. Mhm.
Yeah.
Yeah, so I do teach a form of elongations, using these bars behind me, if you're watching a video of us right now. But we do it with engagement of, the lats, some of the back muscles, the core, and we're never going into that fully unengaged position of that dead hang. There's always an element of tension and of engagement through the body while we're going through them.
Yeah, absolutely. And, similar connection in yoga, many postures. People maybe newer to the practice see so many positions as just an opportunity to stretch as much as possible, especially like things like triangle poses or forward folds, just like opening up the backs of the legs so much that they're just stressing the attachments near the
Okay.
joints. And it can be so maybe feeling good in the moment, like you said, like, oh, big stretch, but end up really wear and tearing. And uh, in every yoga pose, there's a strength component and a sort of lengthening or opening up component, I suppose. And that balance is so crucial. Otherwise, you're just hanging and
Mhm.
letting everything go, and there's no infrastructure. There's no
Yeah,
scaffolding.
no
Um,
integrity. Yeah.
yeah, tensegrity is such a good word. Absolutely. So you mentioned before your affinity for Pilates in particular, and you use this method to you use this method as a therapy for scoliosis. Why do you favor Pilates, and what are sort of the key components that you see having good results with your clients?
hmm Um, Pilates in particular, especially the way that I work with my patients, especially in person, we use resistance in addition to the work that we're doing. So whether that is a leg spring, or arm springs, or even using like a cable system like the Ancore system, um, by using that resistance, it forces you to have to connect into the tensegrity of your body in order to remain upright and support yourself in those positions. So I like that aspect of it where you can use that resistance as assistance or as an actual resistance to build strength and postural awareness as well. So um, part of the Pilates philosophy is connecting into um, an awareness of where you are in space. So you're constantly going through a checklist of, okay, where are my feet? Where are my knees? Are my knees locked out, or are they soft, or are they pointing up in the same direction, different directions? And then you go through the whole checklist of the body over and over and over again in every position that you're in. So it forces you to improve your proprioception, which is completely lost for people with scoliosis.
And for those unfamiliar with the word proprioception, what does that mean?
Proprioception is awareness of where you are in space, or a joint position sense. So it's if I have my eyes closed and I'm raising my arm up overhead, it's being able to kinesthetically or physically feel that my arm is raised and like where it is, or how high it's raised, without me actually looking at it.
Mm. I imagine that's super important for subconscious protection of the body, especially for people with a curve.
Mm-hmm. Yeah.
Yeah. Okay. Makes a lot of sense. And you talked about, for example, if you're working with somebody and you do decide to engage in one of these dead hangs as a lengthening mechanism, you talked about how you're making sure they're engaging the lats and the core. And what about engaging the core in particular is important for scoliosis?
Mm-hmm. So engaging the core is important for that side profile view of the spine. Um, if when you're hanging, the tendency would be to go into like a big back bend or a big arch of the spine if you're just kind of letting those muscles disengage, when you're in that overhead position with the arms and the feet dangling. By engaging the core, it helps to pull your spine into a little bit of flexion out of that hyperlordosis or hyperextension position into more of like a neutral or in between position so that you're not in that end range extension. But we're also not going so far that we're going into like an end range flexion the opposite way. We want to be somewhere in between.
That makes a lot of sense. So you've mentioned a few different modalities you use to work with your patients. If you were to have to prescribe a few exercises to the general scoliosis population, one, is that even smart to do? But if it did make sense to do, what are some of the things you wish people with scoliosis would be doing on a daily basis to take care of their curve?
Mm-hmm. The first one would be elongation, some form of elongation. And I like to start people at the wall, and you're standing with your feet like a couple, like maybe a half foot away from the wall, you're facing it, and then just sliding your hands up the wall and trying to lift all parts of your rib cage away from your pelvis as much as possible. And you're using the wall and you're using your shoulders to do that lifting. And then when you kind of relax a little bit, you want to try and use your um, the strength of your muscles to hold the rib cage lifted away from the pelvis. Um, an error that people can make when they're doing that elongation is just to simply like really lift that front part of the rib cage further away from the pelvis, and then the back part of the rib cage is actually compressing further towards the pelvis. So the key to it is to make sure you're lifting that whole cylinder of the rib cage equally away from the pelvis. And even just thinking about that throughout the day without the use of the wall can be super helpful and improve the compression that a lot of people feel through their spines with scoliosis. Um, and probably the second thing would be learning how to breathe three-dimensionally, making sure that you know, taking breaks throughout the day and just spending some time making sure that they're able to expand all directions of the rib cage, all directions surrounding their core. So that's not just your belly, that's actually your low back as well. And, when I talk to people about trying to visualize breathing into their low back, they look at me like I'm nuts, but you can actually do that. It's possible to uh, get your breath to expand backward into those areas of the low back that do get really compressed. So
Yeah.
super simple things, but not probably not something that many people would think about.
I think people don't realize how important proper diaphragmatic breathing is for spinal stabilization, especially given how much we sit.
Mhm.
And when we sit, and like you kind of mentioned about maybe the emotional components of scoliosis, maybe not rooted in an emotional woe, but same postural imbalance can happen just sitting all day long. The concavity of the front body, that flexion of the spine, which makes it so much harder for your body to breathe properly, to get that full contraction of the diaphragm. And I mean, I don't need to tell you, lower back pain is like the number one complaint, pain complaint in the US, and one of the top reasons people are missing work. And just to conceptualize, like you said, that 360-degree breath, not only is that going to change the way your spine is supported, it's going to change your mood. When you're sitting, when you're sitting properly and your lungs aren't depressed, you feel less depressed.
Exactly.
Yeah,
Exactly. I love that.
it's um yeah, the breath really mirrors and influences emotion. And I can imagine, especially for people whose scoliosis might be rooted in some kind of emotional dysregulation or trauma,
Mhm.
um, it's a free thing you can do that can make such a difference.
Yeah. Yeah.
Yeah.
100%. It's so underrated. And people, it's not sexy. So people are like, but you want me to just breathe? And that's going to help me. It's hard for people to conceptualize or wrap their head around how that can be helpful. But that's one of the best things that you could do. That's pretty much the essence of the Schroth method that Katarina Schroth created, is all situated around the way that you're breathing. You're using your lungs, you're using your diaphragm to act as an internal pressurizer. That's not the right word I'm looking for.
Yeah,
Uh,
I know what you mean.
but basically, you're using those muscles to push the areas that are collapsed in outward, like a deflated ball, a partially deflated ball. That's essentially what's happening with your body when you're using your breath to expand three-dimensionally.
Yeah. I mean, if you think about the primary function of the diaphragm and really what it's actually doing to benefit the body, it's the job of the diaphragm is to create as much shape change in the torso as possible so that you can change the pressure dynamic in the torso to bring in more air into the lungs. And without that proper 360-degree breath, you are diminishing your capacity with every breath, right? Like the pattern can get so ingrained, and it can feel, like you said, unsexy or boring to just sit there or stand there or lay there and work on the breathing. But to be able to create that shape change in the torso so that you are pulling apart the corners, inflating the ball, bringing more air into the body, it is such a profound therapy that not only benefits spinal conditions, but emotional conditions, pulmonary conditions, respiratory conditions. Learning to breathe properly is a life skill that we should be teaching every second grader.
Yes. Yeah.
Like, I'll die on that hill.
You
I will.
know all about it.
Yeah. I'm glad we're on the same page.
Absolutely.
So okay, so the spinal extensions, hands at the wall, proper lift of the rib cage away from the pelvis, good 360-degree full diaphragmatic breaths. Okay, so those are some exercises, some behavioral things to spice into your day that can really help. What about props? Are there any props you would recommend people with a scoliosis have on hand?
Definitely. I am the ball lady. All the balls that you could possibly imagine, I have my patients purchase or actually like send them home after their first visit with me. I have a little kit of balls that I just give them because I'm expecting them to use all of these, so I may as well give them as a little gift. But um, small yoga tune-up balls, and then medium size, large size. We use them all for myofascial release, and then a squishy like Pilates ball that you would think of when you think of Pilates, and then also scoliosis wedges as well. They can be wonderfully beneficial for helping you with the derotation of your spine. I use them in two different ways. So the first way is non-conventional, like scoliosis way, where we're actually propping the person in their curve. And that's probably a way that you've heard of. I think yoga tends to do this well. But that's where you're bringing the floor up to the person and you're filling in the empty spaces. I used to think like, oh gosh, this is wrong because that's what I was taught in my scoliosis training. However, in other training that I've done through visceral manipulation, we are taught something called an induction, like how to create an induction in the body with the visceral manipulation. And that's where we're taking the organ that we're working on and we can sense and feel where the greatest restriction is, and we take it further into that restriction so that we're creating an induction, which is a reflexive pattern or a reflex in the body where things open up in reaction to being pushed further into the restriction.
Kind of like the opposite of hanging at the wall and then going back into the restrictive pattern.
Yes.
It's the opposite.
Yeah.
Got it.
Mm-hmm. Yeah, so that's one way that I use the wedges. I take them further into the restriction as a way of kind of resetting the nervous system. It helps with nervous system regulation, helps with pain, helps to derotate. So if I'm just starting out with somebody, that's how I would prop that person. Um, Once their pain levels have decreased, they're ready for more strengthening exercises, corrective exercises, then I would prop them the opposite way out of their curve. Um, so
What do these
that's
wedges look like, just for people who are listening? And I'm sure you have a
in here.
perfect.
Yeah.
Yeah,
So
so they're
they're like little triangle wedges, and you stick the narrow end in first, and then you have the wide end sticking out the side of the body. So if you were to prop, you would want to make sure that you have like a little bit of the wedge poking out the side.
yeah.
And
So they look like little blocks of Swiss cheese, and she's putting the sort of tip of the triangle, the skinny part, towards the proximal area of her body, and then the fat part out towards the distal ends of the rib
Mhm,
cage.
mhm.
Okay, that makes sense. Those look
Yeah.
like they would be great for anybody,
Yeah.
let
Yeah,
alone.
they really are. They're wonderful.
Yeah. We'll put
Yeah.
all the links to these products in the notes below, so if people are curious.
Mhm.
Okay, so the balls, the wedges, the ball lady, that's so funny.
Yeah.
Balls, wedges, anything else that's great to have on hand?
And then I would say, yoga blocks are nice, just for positioning for some of, if you get further into the scoliosis work, we use the yoga blocks like in side lying to keep the head in line with the rest of the spine, or even in supine, laying on your back, we prop the elbows up onto the blocks because a lot of people with scoliosis have something called flat back, where their spine is actually like really straight through the thoracic spine. They kind of lose that thoracic flexion of their curve. So having their elbows up on the blocks and doing the breathing, it helps to direct the air backwards towards the back of the thoracic spine.
Yeah, and I know that you have a wonderful resource that is your Instagram. And so for people looking for some demos of these tools, Meghan is at the Scolio Therapist on Instagram. We'll link that too, but she's constantly demoing little tips and tricks like this, so you can get a visual.
Yeah.
Um, Before we sort of get into our typical last question, uh, is there any kind of message you'd like to give to people working with a curve and really in the thick of either discovering or treating their scoliosis? What would you say to this group of people?
hmm I would say, be your own best advocate and listen to your body. Um, Having scoliosis, you tend to offload ownership of your bodily autonomy to medical practitioners, movement professionals, and you kind of go with the flow and do whatever that person is telling you to do. But if something isn't feeling right in your body, and somebody is forcing you into a position that doesn't feel comfortable for you, please speak up and, make sure that you're having an open communication with the people that you're working with. Because, this is the only body that you get, and, you have to be your own best advocate and basically your own best friend through this journey. So, it's really important to learn how to listen to yourself and listen to what your body needs. Um, that would probably be my biggest advice to people starting on this journey.
Yeah, so important. Be your own best advocate. I love that. Um, so to close out the show, we always end with the same question, which is, Meghan, if you weren't doing this,
Mm,
what would you want to be doing?
this is such a hard question. Oh goodness. What would I want to be doing? I think I would want to be a plant lady, maybe.
From ball lady to plant lady.
Ball lady to plant lady. Yeah, I think I would really love to, spend time um, making a beautiful garden for, myself, and then also like teaching other people how to manage plants. And, I really feel best when I'm in nature and outside. So it would be awesome if that was like part of my job.
Who knows? Maybe there's maybe there's going to be a plot twist down the line. Well, thank you so much. I feel like you've provided our listeners with so much helpful information and also practical advice. So thank you so much for sharing your expertise with us. It is truly a gift that you exist and are doing this work.
Thank you so much for having me. I was happy to be on here, and yeah, you can follow me on Instagram if you want more info. And then I also have a YouTube and podcast. I'm ahead of the curve on those things.
Yes, Meghan's podcast is called Ahead of the Curve. You can find it anywhere you find podcasts. It is excellent. She constantly is just herself spreading her wisdom and collaborating with other professionals. We'll link everything about how to find Meghan down in the show notes. If you want to work with Meghan, we'll give you all those links. I know a couple Better Yoga folks have made their way to you, and they're really glad that they did. So thank you, Meghan. Thank you all for listening. And until next time, be your own best advocate.
Bye. Thanks for having me.